Blake Wallace, an orthopedic surgeon specializing in foot and ankle surgery at Plano Orthopedic and Sports Medicine here in Plano, Texas. And today we're going to talk about Achilles tendon ruptures or tears. This is a very common injury, especially in the middle age-ish age range, depending on your definition of that. And most people say that they feel like somebody kicked them in the back of the leg, you turn around and nobody's there. So usually with like an explosive movement, lots in soccer, basketball, volleyball, and that type of thing. And what we see on the exam, when you come in here, I like to have you lay on your stomach with your knees bent and your feet up in the air. And when we squeeze the calf muscle on your normal side, then your foot starts to point down because that Achilles tendon is intact. And then we squeeze the side where it's ruptured and nothing happens with your foot, or very little motion happens with your foot. And then we're gonna push on the back of your ankle and most likely feel a little gap there. And also while you're laying with your knees bent, we're gonna look at the resting tone, because your normal side is probably gonna be pointed up like this and your abnormal side kind of sagging down if that rope in the back has been cut or torn. So with those three things in mind, I like to get an MRI, mainly for surgical planning, because that helps us plan our attack. So if you find yourself with an Achilles tendon rupture, there are two ways you can go. There are some non-operative routes that have produced some decent results, or you can go with surgery to help tie that tendon back together, which has a lower risk of a re-rupture and a higher functional outcome at the long-term follow-up. So my personal preference is to do surgery, and the old way of doing surgery is a fairly large incision where it's an incision along the back of the leg. We go in and tie those ends of the tendon back together. Now that's an area of the leg that doesn't have a great blood supply, so there are some wound complication rates that are fairly high with that. And so I favor a minimally invasive repair. So that's a small incision sideways, and ends up being about an inch long. We've got special tools that allow us to go up and reach and pass sutures through the proximal end of the tendon, or the one higher up where your calf muscle is, and then the same device goes down and puts the sutures through the other end of the tendon, and then we're able to tie it together all inside that smaller incision. Now, there's no way to recover quickly from an Achilles tendon rupture with or without surgery. It's a very long recovery, and it's taken professional athletes 9 to 12 months historically to get back to playing. Some have scooted that up to even like 4 or 6 months, with some notable ones in the NFL playoffs last year. But unfortunately, the average person is not waking up and just rehabbing all day long. So I tell people usually about 9 months until you're kind of back to everything that you want to do. So my post-operative protocol, we do surgery. It's a day surgery and takes about an hour or so, maybe even less. And I keep you off of it for 2 weeks in a splint, so you get some crutches or a knee scooter. And then I'll let you walk in a boot with wedges, so that points your foot down and takes the tension off of that tendon repair. And then at the 6-week mark, we start taking those wedges out. And then at 8 weeks, you're getting out of the boot. And there's a lot of PT or physical therapy that comes along, starting at about 4 weeks from surgery. So here's an MRI of a patient that I've treated recently. So he was playing sand volleyball, went to jump and felt a pop, looked behind him to see his buddy and who kicked him, and nobody was there. So he had all the classic signs: the palpable gap, he had increased resting dorsiflexion, and what's called the Thompson test, where we squeezed the calf. His foot didn't move at all. So we get the MRI to confirm that diagnosis. And so this slice of the MRI is looking at the foot and ankle from the side, so kind of like that. And you see the Achilles tendon is this thick black line that comes up here, and then it kind of goes away, and then it comes back. So this is the rupture site right here. And so we we took him to surgery and tied that back together with that minimally invasive technique, and he's been recovering well so far. So the reason I prefer the minimally invasive approach to an Achilles rupture is because there's a much lower risk of a wound issue back there, and because of that, we can start rehabilitating even faster. Because if we're worried about the wound back there, then I can't let you start moving it, can't let you start walking on it. But that transverse incision heals very quickly, and it's pretty much always healed by that 2-week mark, so we can let you start walking and getting back on the road to recovery. And there are some new rehabilitation techniques that are targeting strengthening both the tendon and strengthening the muscle that's attached to it, or that big calf muscle, because one of the things that has kind of plagued us as foot and ankle surgeons has been the calf atrophy. So the old adage is, if you don't use it, you lose it. So if you tear that Achilles and that calf muscle starts wasting away, it's hard to get that back, and it can take up to a year, sometimes 2 years, to really get a full muscle mass back there. But with some of the newer techniques that we're using, we're seeing improved calf circumference or size of that muscle at earlier stages, just by altering the ways that we do rehab. And so there's a lot of promising evidence that's coming out about that. And one of the benefits of having trained fairly recently is that I was encouraged and forced to learn all of that. So it's that's something that I've started incorporating into my practice. The minimally invasive repair is something that we can treat most Achilles tendon ruptures with. There are slight variations of it if there is a history of Achilles tendonitis, or if you had pain in the Achilles prior to that injury. Then instead of tying sutures to sutures, we can take the sutures from the top and actually anchor them down into the bone in the calcaneus, or the heel bone. And so the MRI is a useful tool and helps us decide which one of those techniques we're going to use, which ultimately is going to help us decrease the risk for a re-rupture or a new injury afterwards. So that was a little bit about Achilles tendon ruptures. Again, I like a minimally invasive repair and trying to get you back as quickly as possible, with some guarded expectations that it's going to be a long recovery, but we can get you back.